Hey, what's up, everyone? Welcome back to the latest episode of the Modern Patient Experience. I'm your host, James Furbush. My guest today is Brian Hall. He's the CEO of Koha Health. Brian, welcome to the show.
Thanks for having me, James. Excited to chat patient experience.
Oh my gosh, I'm excited to have you on as well. So, Brian, a little bit about Koha Health. You guys just did a rebrand. You were previously known as Physician Resources Limited, but I'd love to just hear just a little bit about Koha, where you are in the market, just a little bit of that context of who your organization.
Perfect. Happy to share. So Koha Health is what we call musculoskeletal rev cycle and strategic advisory firms. We focus on orthopedics, spine, pain, and everything that goes with that, whether or not it's ASCs and imaging or physical therapy, DME. So really, narrow market that we attack, which is, obviously a fairly substantial market nowadays with our aging population and the growth of the orthopedic side in particular. And we'll provide everything from modular rev cycle, meaning we'll do pieces of the rev cycle along the way. We'll do the whole thing. We do some rebadging work. We take over existing CBOs. And that's a large portion of our probably the largest portion of our business as of late is really taking on these existing CBOs. And then we'll do a bunch of strategic advisory. So we'll come in and help practices expand ancillaries, get an ASC relationship, bring in new providers, comp packages, interim, rev cycle director or coding manager work. So a little bit of everything that, we keep using this term drives total financial health, but really helps our practices succeed, not just in the core rev cycle of billing and collections.
Yeah,
Yeah.
that's awesome. So really providing, much more than just, I don't want to say like pushing buttons, but
Yeah.
really like that sort of partnership where you're doing some of the rev cycle, but then also helping to advise, honestly growing their business and things like that. That's awesome. You were saying when we were previously talking, a big part of your business is patient satisfaction. And I'd love to hear, how you think about the sort of those drivers of patient satisfaction for your business and Koha Health.
Yeah. And I think that's a great point, James. For me, and you can ask my leadership team, and I've been echoing it for years. We feel like the patients are an untapped market for us in the rev cycle. Well, a lot of people in my industry don't typically get involved with the call center side of it. They leave that with the practices or with the big MSOs. And we look at it differently. We feel like that's a great opportunity to help our clients drive their side and really help our market grow. So I think there's a lot, and I think, there's a lot of key, bunch of drivers. I think there's a few key ones. And I think it starts honestly with culture and happy employees. I think, there's always been this mindset that call center was, an afterthought. People, it wasn't the highest skill set. It wasn't the investments were made there. We looked at it differently and said, look, we invest a company wide in our culture anyway. And we always talk about this term internally about showing the love, not just to each other, but to our clients and to their patients. And that I think drives it. Is one of the key drivers. If you have a great culture, you have people that are happy doing their job, it's going to be reflected in how they treat the patients and whether or not that's, through chat or live voice or whatever it might be. So I think that's one big one. I think, resolution time is key. We're all busy. I think, in the last few years, people have gotten even probably less patient. You've got to be able to resolve the problem quick, and you got to be able to resolve it the first time. Nothing's more frustrating, for you or me as a consumer to have to wait for someone to call you back or have to wait 3 or 4 days for resolution. So we look at, culture and happy employees, first time resolution. And then I think having multi-channel communication options or omni-channel, whatever term you want to use, patients want to connect with you the way they want to connect with you. Some people like the phone. Some people want to do email. Some people want to do chat. I think you have to have, multiple options in there. And those are really, when I think about it, 3 of the key drivers we focus on. There's a few other things in there. Callback functionality and hold time are obviously equally important, but I think having that flexible communication channels, having a great culture, and then really resolving the problems quick and empowering your team to get it done.
Yeah, that's awesome. I kind of want to dive into each of those 3 things because one, culture is probably very underrated as far as a business goes. But so why don't we start there? So how are you creating a culture within Koha of putting that premium on patient service and customer service and really keeping your patients who are paying bills through Koha really happy with the service you're providing.
Yeah. And I think, the point with that is if the patient's happy, they're more likely to pay the bill too, right? So for us, I think it starts with me. It's setting the tone and understanding that, how you treat your people, how you interact with your people is going to trickle down and trickle, into your customers and your patients. And for us, we make a concerted effort to really focus on that. Our vision is to be the most loved healthcare services firm in the country. So that's really where it starts is our entire team understands, hey, everything we do is going to make sure people love us more. And that was, I think key. We spent a lot of time championing it. We spent a lot of time on our values. We really think about our mission, which for us is, and I think a lot of people set mission, vision, values, and they never talk about them. We talk about them at every meeting. We make them part of every all hands. We open every one of our leadership meetings talking about it or sharing a kind of a mission moment. I think it starts there. The more you talk about it at the senior level, it just, matriculates through the whole organization and just, really becomes part of how everybody thinks. And you think about if you're really talking about and spending a lot of time on it, celebrating those great experiences when you have someone in your call center that's dealing with a patient and it is a tough conversation or patient's unhappy, what's going through their head is how do I make sure this turns around? How do I make sure this patient loves Koha when the conversation's over and loves their practice that they go see? So that's really, where we just make it part of everything we do. We tie our everything back to our values, back to our mission. And I think that was the key piece. You have to be deliberate about it. You can't just set it and say, okay, just because we say we want to be the most loved, let's just leave it there. You have to make it part of everything you do and you have to celebrate it. And I think we all know the patient experience or patient contact centers, that's a hard job. I'd argue it's the hardest job in our business. Patients don't love paying healthcare bills. I mean, it's just the nature of it where we're all frustrated as consumers because our premiums go up, our deductibles go up, and it's never, not always a great experience. So for us, really having that focus on the culture and making it part of everything we do and communicating regularly is where we had the results.
Yeah. The call center, just like mad respect to anyone who,
Yeah.
'cause I feel, it's like when your patients like, they're grumpy because they have to pay the bill anyways. They're grumpy because it's like, there's something wrong that they have to call.
Right.
If they have to wait on the phone or deal with a phone tree, like all of that stuff, just by the time they get to a human, it's like they have no patience for it. What do you guys do in that call center to really make them that valued employee and really, I think, set them up for success in terms of driving patient satisfaction?
Yeah. I think it's a lot of things. It's investing in training, right? We want them to give them the skills they need, give them the technology they need, because you can't just field calls all day. There has to be other, tools that you use to help ease some of that, whether or not it's analytics or AI and some of the things that I think we'll talk about as trends that we're seeing and things that we've adopted. But one is that training, making sure they're comfortable with it, giving them time. We focus, make sure they have time off the phones. So we deliberately close the call center during certain hours without affecting the patient experience. And two, we allow our team to rotate through. So someone will come off and work on follow-up or documenting some of the cases that came in and really managing some of that. So I think you have to find that balance. And again, making sure they're feeling appreciated and respected, whether or not that's, making sure that you're celebrating them at all hands, I think is another key piece of it, but really making sure they have some balance. You can't field phone calls 8 hours a day, 5 days a week. You have to be able to, spend some time on other tasks. And that's where the kind of the omni-channel communications allow them to focus on something else, whether or not it's chat or email for a time period, get off the phones, work on some follow-up and things need to get done too. So we try to make sure there's always a balance there.
Yeah, that's awesome. So have your communication channels, good segue, have they changed in the last few years? Because it used to just be phone, email.
Yeah.
Now it's like text. Now it's Facebook
Yeah.
Messenger, business, whatever. Like, I feel like there's just so many communication channels. How do you figure out how to communicate, what channels to use and navigate that
Yeah. I
for
think it's
patients?
the idea of having the patient have options, right? So phone is great. Email is great. Chat obviously is huge and continuing to grow. And we're implementing some new tools there that I think will take that to the next level. SMS is there. You have to have the two-way messaging if you can. And the chat solves some of that through it as well. And I think it's really just having flexibility because again, not everybody has the time to call. And the other thing I think is it's funny. We all know IVR has been around for decades
Yep.
and I feel like it disappeared for a while and it's come back. I think there's still a place for IVR, because now with voice recognition, AI, you can really enhance the IVR. So I think it's really just making sure those things are readily available to the patients so they understand how to access them, because they're not all going to pick up the phone. And again, they can there is still some of the portal stuff too. If patients are comfortable there, we see less adoption, as you can imagine, there more than anywhere, but really just having them all at their fingertips. If they do get an SMS, is there a number they can call if they want to talk? Is there a website they can go to if they want to chat, right? So having it all available.
Yeah. Really kind of meeting patients where they
Exactly.
want to be, I suppose. I'm curious about this IVR coming back. You mentioned with AI and some of these other newer technologies layered on top of that. What has that, are you doing anything in that realm with?
Yeah, so it's funny. We actually had turned off our IVR a few years back and then brought it back, I think, during COVID. And yeah, I think it's allowing you to really route calls effectively using speech recognition or voice analytics, whatever you want to call it in there. But that's the key piece that we've seen is it used to be an IVR. You had to push a button, have to do this. Now they're getting smarter. We've implemented some new products here that allow it to make some of its own determinations through the process. And that wasn't the old IVRs were push one for this, push two for this, enter your credit card number if you want to pay, that type of stuff. So now it's got voice recognition so that you can speak into them, which you couldn't 15 years ago or 20 years ago effectively. But two, it also will help route the calls effectively based on some of that as well. So those are the big changes versus relying on the patient to just hit zero every time if they don't, if they want to get through quick. Those are the big changes that we're seeing.
So it's almost like having Siri or
Yeah,
Hey Google like baked into the IVR, so the person can just be like, I want to talk to so and is smart enough to.
It's getting there. Yeah, I would say it's not quite that sophisticated yet, but getting close for sure.
Oh, that's wild. Still used to anytime it's push one. And my thing is I always end up listening to all the options and then I'm too slow to go back to push the one that. So what kind of initiatives are you working on? I'd love to hear you talk about with respect to patient satisfaction, some initiatives that you've been working on at Koha Health for the last, couple of years. It's like, how are you evaluating things that you want to add to your business? Because one of the things that I appreciate about you is that you are always like innovating, right? You have a culture of innovation at Koha to try new things and add new things. And, I'm curious to hear what sort of initiatives you've been working on related to patient satisfaction over the last couple of years.
Yeah, I think there's two, and I'll talk about the tech piece as a secondary piece. The big initiative we've done over the last few years is really focusing on patient surveys. And I not anything overly innovative, but I think the way we solve the problems is a little more innovative. So ultimately, we survey every patient, gets the option as part of their call or text or whatever it is they come in on. We're getting about a 30% response rate, which by the way is, I think, very high based on, industry. And the big thing we do is patients rate us. We're coming in at a high score. We've been in the 96, 97 rate, 96, 97% for the last year or so. But the flip side that we did and really made the effort to invest in staff, because it is a little bit manual, but not tremendous, is following back on those patients that give you bad scores. So it's great that we fill out a survey and we give it a 1 or a 2, but if, closing the loop on it, and this is where we've added some, in one particular a VP of client experience, it's really focused on the patient experience as well as the client experience. But that was one of the things we really saw a big difference in is now that I take a survey, I'm not happy with it, I give us a low score. We're taking the time to look at, okay, let's map this patient's experience. What happened along the way that could have influenced this? And then we're actually going back to the patient. More often than not, that could be a phone call, could be an email asking for a phone call, but understanding what the experience was and then creating an action plan from there to down the road to hopefully eliminate that for future patients. So that, when I think about innovating, from a non-tech standpoint, that's one of the things that we've done that's continued to drive up our patient sat, continue to make sure our patients are very happy with it. And I think that's a big thing. We all get surveyed, but how often do we get anybody closing the loop on our surveys and coming back to us, saying, hey, why did you give us a one or a two or a three, in the score? So that was a big piece that's one of the things we really focused heavily on. It is a little bit of a people thing, but it's also having the tools to be able to filter that, use the analytics and really drill down into where the problems are.
You almost never get any company following up if you
Yeah.
fill out a bad survey. And I love so much that, right? Because I feel like so people talk about, oh, we're doing AI this or blah, blah, whatever that. And like the simplicity of a patient survey, like literally just asking, like, how was your experience or whatever it is, the questions that you're asking, so that you have a concept of being able to like measure, right? If that satisfaction
Yeah.
rate dips below 90, I would think for you, it's, oh, that's a red flag, like a signal, like, oh shit, like something we need to like
Yeah.
address this. And like to your point, like it doesn't sound sexy, but it sounds like it's had a huge impact, at least for you, on your patients and satisfaction within your business.
Tremendous. And James, for us, if it goes below 95, that's our own shit moment.
Okay.
We track that monthly, part of our leadership discussion when we look at our scorecard of the health of the company every month. But yeah, it is interesting because everybody said, we've all gotten surveys where we get an automated response that says, hey, thanks, whatever, nothing else ever happens. We felt like you can't take the personal out of healthcare. You can do it. We all are relying on AI. We're all relying on automation, robotic process, yada, yada, all that wonderful stuff, which is key to our success. But there's certain things you can't you got to people still. And we feel like having that personalized follow-up, and maybe, is it 100 patients? No. Is it 50 patients? Maybe every month that you got to circle back with, maybe less than that. They may have given you a subpar score. But I do think it is to your point, it's an expense, but we're seeing the upside of that is if our patient sat rate has never dropped being below 95, that's a pretty impressive stat in a rev cycle call center. I think you'd be hard pressed to find anybody, one that's measuring it, to anybody that's actually, that high in a lot of cases.
Yeah. So I'm curious on what are some of the sort of survey questions that you're asking of patients? I guess we'll just start there.
Yeah, I think there's 3 or 4 questions, and one is around, how the competence of the rep you were speaking with, were they able to answer your questions? Were they professional? 2 was, how quickly your problem was resolved, or was it resolved? 3, I think, is the use of the technology. So maybe 3, actually 3 questions. What was the ease of experience? How quickly could you get to what you needed to do? How long did you wait on hold? Did you have to hit 6 buttons when we talk about IVR? So that's 1. 2 is how, was your problem resolved up to your standards? And then 3, kind of the professionalism of the rep. And there's different wording to it, but those are the gist of the 3 questions.
Yeah. And then what do you do with the output? Once you have all that stuff, then what do you do with the survey data?
Yeah. So we take it, okay, again, to your point, we look at where we're getting the compliments and understanding that, okay, that makes sense to continue to invest in that. We look at areas where we're getting the negative scores. We take that data, and if there's a trend, it's always interesting because sometimes it could be, we'll look at not just across the board, but it may be a trend with one single practice. It may be a trend with one single provider. Might be a trend in one single geographic area. So it allows you to drill down and look and say, okay, great that our score was, we received these, 10 threes, but where did they come from? Okay, they all came from one practice. Okay, so is there a systemic issue with the way we're, producing bills or billing there, or is it one geographic area? So it allows us to really, turn the wheels and not just, okay, great, we got a 97, here are our problems, and here is our upside. We can look at exactly where it's coming from, and more often than not, there's a trend. It isn't unique. You'll see that it could be in a particular payer related, quite honestly, too. It could be practice related. It could be as far down as provider related within the practice. It could be one particular rep here that's struggling in some areas. So we're able to look at and say, okay, now we can make an action plan that says, okay, we've got to do some additional training at the office around our mobile-based solution because the office isn't informing the patients appropriately or giving these right information, or our rep is struggling to explain what happens when a client gets a visco injection. This is where the complaints are coming. So you can really think about how fine-tuned you can get.
Yeah. So could think like, did you ever run the risk of getting too fine tuned, or like, how do you find that balance between, 'cause I think it's great. Like if you could get like pinpoint reps who maybe need better training,
Mhm.
right? Like, all right, let's go talk to Chad. Chad needs to work on his bedside manner or whatever that is. Or, you're going to work with the practice on certain things. If it's like, hey, you guys got to do better education at the front desk, this is we're hearing that. But how do you find that balance between having actionable data that you can use versus having too much data where it's like, what do we even do with this?
Yeah, you've got to we always look at the top two or three things. You can't, there's a whole bunch of one-off stuff and you can't worry about fixing. You're going to continually have, no matter, we're all in healthcare, right? There's going to be one-off problems. When we start to look at trends and we've got 100 responses and, 12 of them were for this one reason or 15 for this one reason, maybe even less than that, it starts to allow you to look at it. We're going in with the mindset that you can't change everything, but if you focus on those top one or two, maybe three, and address that, it makes sense. That's really how we've always looked at it, with the mindset that no matter what you do, you're always going to have the one-off issues that just pop up. And, that's the nature of it. You can't try to, it doesn't make any sense to waste a bunch of energy trying to, change a workflow or based on one problem. It could be the patient was having a bad day, your rep was having a bad day, and you work through it and you're done. But it's really just trending it and staying higher level as far as the issues list.
Yeah. What do you advise? What would you advise like other practices who maybe are doing patient satisfaction surveys and things like that? Do you guys have a framework? Or what would you tell someone? Hey, if you're going to start doing this, here's what we learned. Here's the three considerations we made. This is what you really should know before going into an initiative like this.
Yeah, I think the big thing is finding a product that makes sense. And we're using, I think we've tested a couple of different products and landed on one. And I don't recall the names at this point, but really making sure you got a product it's easy to use, easy to manage on that front end that you can execute on. It doesn't require the patients to go through a lot of work. I would say the other key piece of that is keeping it short. 3 questions is about the max. You can already, you can you can go down to one question, two in a lot of cases, like a net promoter score type thing. But I would keep it short, sweet, because patients aren't going to answer 5 questions. They're not going to answer 10 questions. They were going to answer 1 to 3 max. And we've toyed with that a little bit. We've dropped it down and moved it up, and 3 seems to be working very well. And then I'd say the biggest thing is making sure you have a plan to execute on the data. So it's great that you get the data, but if you're not doing anything with it, it actually will hurt your credibility more. If you're surveying these patients and now that you're just never adjusting and never following up or never closing that loop, it's not going to do any good. But I think it actually hurts your credibility, just like it would with your employees. If you were surveying your employees and then never doing anything to improve the things that they gave you feedback on, think of what that does to your credibility. And I think it has the same effect on the patients.
Yeah. And so for you guys, like following up, what do you do when you do follow up? Do you guys have a sort of strategy in place for, we got a really bad, this patient gave us a really bad review or survey, whatever. How do you then follow up? What's your plan for following up with that
Yeah.
patient?
I think, I think what ends up happening within in the department, depending who's assigned to it, we'll obviously do some research, understand what happened in the case. And then it's going back to the patient. Honestly, in some cases with the patient's just apologizing. It's a bad experience. Understand that we didn't get it right. We're going to do our best to get it right next time. And really doing that. And then also within the survey data, you can track within the systems we use, track the resolution. So we understand what happened to that patient, who called the patient, what the conversation went like on the closing the loop, and really having that data at your fingertips too. But that's the big thing, is just, making sure that you're documenting it in some form, you're tracking it, you understand what happened. And then two, understanding that you're not gonna be able to solve it. Sometimes it is just an apology. Hey, we got it wrong and we're gonna do our best to get it right next time.
It's funny how much just a simple apology,
Yeah.
it sounds so dumb, but it's funny every time, at least for me, like have like bad service or whatever. And at some point, like all you want to do is just be heard and just have someone say, I'm sorry, like we blew it. we'll do better next time. And then, okay, cool. Great. Thank you. That's all I wanted to hear. And yet, like some businesses can't even get out of their own way to just suck it up and say, I'm sorry.
There's some stats out there, James. Like most patients, and I don't know what the number is, but most patients aren't looking for anything other than an apology or for ownership. They just want to
Yeah.
know that you got it wrong. And it's a big number. You'd be surprised. It's not like patients looking for you to comp their bill. We empower our team to offer up a gift card or something if we really screwed things up. But, but really, most patients just want to know, hey, we owned it, we got it, we apologized, and we understand that we got that wrong. And that's what most patients want.
Yeah. That's incredible. So the patient survey initiative has been a game changer for you guys. We're coming up on the new year, almost 2023. What are you looking at related to patient satisfaction initiatives? What's on your eye for kind of the
Yeah.
new year? Are you guys working on anything?
Yeah, three or four things. One is continual training. We're spending a lot of time, we're working with whether it's internally, externally. We think that continued investment into the staff training is key. That's going to be critical for us. And I think that's a pretty, I think, again, not a lot of companies are focusing on that training. I think, really starting to focus on the omni-channel contact points. We're already there in some cases, but just like anybody else, we've all got room for improvement there. And I think patients are going to continue to want flexible responses. Is there a way to get to a 24-hour ability to chat and respond to patients? All these things that we're not currently doing that I think could help. So I think that omni-channel needs to continue to expand, and access it's not just, 8 to 5. Can you continue to expand? And we do this on some days already, but is there an ability for us to have, 24/7 availability of patients? That's something we're looking at. Speech recognition, as we talked about, using that more in the AI, in the IVR, using it even in some of the other areas of our business on the call side, I think is key. And I think that if you look at, it's funny because AI technology and speech recognition have gotten dramatically better in the last 5 years, AI especially. So we're looking at ways we can do that, whether or not, and the AI plays in there around intuitive call routing, helping you identify trends without having to manually look at data, auto responses, so all the things that play in there. So I'd say those are the big things: omni-channel, staff training, and then leveraging AI and voice recognition and getting better at it. Those are the big things that I think we're looking at. And I think, probably not uncommon with a lot of our businesses or
Yeah.
competitors.
One thing I'm curious about is, so that you mentioned access and, say going from 8 to 5, but how do you
Yeah.
kind of make that? Obviously, one way to solve that problem is to add more bodies, but adding more bodies certainly adds a certain cost and stuff like that. So how are you thinking about that problem from a operational standpoint where you're scaling maybe what you have right now, but not adding additional costs to your business and things like that?
Yeah. And we've gone back and forth. We don't necessarily think throwing people at it is the necessary solution, right? You could always, and our call centers are all domestic, by the way. You could always go offshore, get the different call hours, right? That's one thing that we've not done. We feel like there's the ability to leverage some form of chat or SMS that's available using AI technology. Maybe there's a people portion behind that, but we think that's where you can start to expand, because the AI's got so much better. Can it answer half the question, 75%? I don't know the answer yet. We haven't gotten there, but I think that's where you can start to look at it. Because if you've got chat and SMS available, and you can tie that to an AI, solution, as well as, some people behind it, I think that'll allow you to also now have 24/7 or something close to that coverage. So that's really where we're focused. We don't think it's opening up a, call center that's going to be available 24/7. I think there's other ways to get around it.
Yeah, that's awesome. And then I want to jump into the training real quickly because you mentioned the importance of training a few times. How do you guys, like one way you could do it is you've got your like training is like a living and breathing thing to me. Like it's not one of those, here's our playbook, please read it and ask any questions. But how do you think about that ongoing training as it relates to patient satisfaction and certain things? Like, how are you guys as a business approaching training?
And I think it's a multi-pronged approach, and for sure. One is we block time. And it's so that it isn't just someone sitting and reading and watching videos and reading, going through a webinar. So we make a point with, I think almost all of our departments, definitely in the call center, to have, 2 or 3 hours a week available for them to go through some additional training. Part of that, it could be, one-on-one, it could be role play, it could be a webinar, it could be, some of the stuff that's out there. We also, are using outside culture, trainers that are helping us in some areas as well. And that plays into that too, right? Because it's understanding empathy versus sympathy, and really how to diffuse a situation with a patient that is, that is going sideways. So we're deliberate about it. It becomes a weekly occurrence. It's not a quarterly thing. It's not a semi-annual thing for us. In the call center in particular, every week there's block time for training. And I think it's 3 hours right now, which allows the entire group either to do it together, or do it in small groups, do it all through departments.
Yeah, that's awesome. Brian, thank you for joining the show today. This has been great. I love sort of the use of patient surveys. It's such a simple thing. Sounds like it's made a huge difference in your business, really providing that foundation for providing obviously patient satisfaction where, you're getting 97, 96% from patients. So that's such an awesome initiative that you guys are doing. Simple, but
Yeah. Doesn't always have to be complex.
it definitely doesn't. All right, Brian, thank you for joining the show. If people want to learn more about you or Koha Health, where can they go to find more about you and your business?
But you can find me on LinkedIn for sure. Anytime there. And then Koha, it's, www.koha, Koha health.com is our website. Contact information there. Actually, I know my LinkedIn is there as well. But yeah, always hit me up. Always happy to share what we're learning, anything we're doing, best practices. Always happy to learn from others as well. So don't hesitate to message me on LinkedIn. It's probably the quickest, easiest way.
Awesome. All right. Thanks so much for joining the show.
Thanks, James.
Bye.
Appreciate it.